This is Raider Alpha 6. Raider Alpha 6, over.
Raider Alpha 6, Raider Alpha 6. Long bid, dust off control, over.
This is Raider Alpha 6. I have an urgent dust-off mission. Coordinates Yankee Uniform 607895.
Situation is insecure. You have gunship standing by. Expect LZ to be secured in 10 to 15. Is this firm, over?
This is Raider Alpha 6. That's affirmative. Request that the dust-off be brought in as soon as the area is secure.
Find out if he's going to need a hoist. He's down the middle.
Raider Alpha 6, long bend, over.
This is Raider Alpha 6, over.
This is Long Bend. Will you require a hoist on this mission, over?
This is Raider Alpha 6, negative, we have LZ.
For a soldier, the war is over, at least for a little while, the moment he is wounded. How soon he returns to the fight depends on how quickly he receives help and the kind of help he gets. In Vietnam, where ambulances come out of the sky, a wounded man is never far from a hospital and has the best in medical care all the way.
Dust off 7-4, this is Manchu 6-5, go.
That's dust off 7-4. We're approaching your area from the north at this time. Pop your smoke at this time. What's your recommended approach into the area, and what is your security?
Roger, we are popping smoke at this time. Recommended direction of approach is from north to south. Tactical situation in, the area is secure.
That's dust off 7-4, understand, approach from north to south. I have green smoke.
Roger, that's affirmative. We have green smoke, and your direction of approach is affirmative.
That's dust off 7-4. I'm on final approach at this time. Let him down.
Roger, we have someone out there to guide you in.
7-4. Okay, lock and load. We're on final approach at this time. Pick up the hedgerows on the left and right. Area is secure. We'll go in as tactical security is not secure. Pick up hedgerows left and right. Final approach.
When an air ambulance is called in by the medic at the casualty site, it comes with enough equipment to provide immediate first aid, resuscitation, and stabilization. Litters and blankets, splint sets, tourniquets and dressings, an airway tube, Dextran and morphine are all on board. A portable resuscitator is also available to the aid man. The air ambulance crew consists of the aircraft commander, co-pilot, crew chief, and a highly trained medical aid man. In advanced schooling at the Medical Training Center in Fort Sam Houston, Texas, aid men learn to recognize vital signs and what they mean. They learn hemorrhage control, shock management, and airway maintenance. The techniques of venipuncture and parenteral fluid therapy, respiratory and cardiac resuscitation must be mastered. along with ways of caring for head, chest, and abdominal wounds. At the Medical Field Service School, also at Fort Sam Houston, air ambulance evacuation pilots receive an intensive course in emergency medical training. Based on information supplied by the aid man in flight, the aircraft commander determines the seriousness of a wound and makes the decision to go directly to a hospital or the nearest clearing station. The clearing station offers the air ambulance a place for those patients with injuries not serious enough to require hospitalization, or for those whose injuries are so serious they will not survive even the short trip to a hospital without more thorough stabilization. Helicopters are also used to ferry patients from the clearing stations to fixed hospitals.
Autoclave 5, Autoclave 5. This is Dustoff 106, over.
This is Autoclave 5, over.
This is Dustoff 106. I'm presently on final for landing at your helipad. I have 3 litter and 4 ambulatory, all gunshot wounds. Request you be standing by the pad, over.
Hospitals with different specialty teams are located in close proximity to one another. With the guidance of the Central Medical Regulating Authority, the pilot of an air ambulance has a chance to choose his landing site. Selection is made on the basis of the types of wounded being transported. In this manner, a casualty reaches definitive care in minimum time. Emergency rooms, whether of the aid station or clearing station variety or in a hospital, are fully capable of providing whole blood, intravenous fluids, and resuscitation. The hospital emergency room has the added support of a complete medical staff. There are radiologists to interpret x-rays and speed diagnosis. The equipment they have is new and capable of providing the expert with a most complete picture. In addition to the normal complement of general surgeons, anesthesiologists, and other operating room personnel, a hospital may have a neurosurgical team or a vascular team, or a specialist in plastic surgery, thoraco-abdominal repairs, or orthopedics. These teams are augmented by a complete nursing service. In addition, medical technicians are on hand equipped to continue the recovery that began with the aid man on the ground or in the dust-off chopper.
How long have you been in Vietnam?
Almost 10 months.
Oh, it's almost time to go home.
Yes, indeed.
You'll probably get evacuated to the States.
Dr. Howard, you'd like to consider this patient for evacuation. What is his name?
If full convalescence can be achieved in 30 to 60 days, a man will remain in Vietnam and return to duty with his unit. If the time involved is more than 60 days, but less than 120 days, he can be evacuated to a hospital in another country, such as Japan. Where convalescence will require more than 3 months, a patient is evacuated to a hospital in the United States. Wherever he receives treatment, chances are he will get there by air.
All right then, Dr. Howard. We'll approve him for evacuation, and he'll leave tomorrow to go down to Tan Son Nhut for evacuation out of Vietnam.
The evacuation of wounded by air is not a recent development. The first recorded use was in the Franco-Prussian War, when, during the siege of Paris, 160 casualties were airlifted by observation balloon. In Vietnam, the dust-off pilots and crews have raised the art of air evacuation to its highest form. Combined with large fixed-wing aircraft, such as Air Force C-130s and the giant C-141, dust-off crews and helicopters form the most mobile worldwide ambulance service in history. Dedicated, unhesitating service to our fighting forces. Evacuation medicine, practiced in aid stations, helicopters, hospitals, and airplanes, is a major factor in assuring America's fighting man the highest survival and return to duty rate ever recorded in modern warfare.